Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to the workshop titled Prehabilitation in Cancer with Dr. Philip Chang. Before we begin, if this is your first time joining us, CSC South Bay mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area, all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Online educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Without further ado, I'd like to introduce our workshop speaker. Dr. Chang is an assistant professor in cancer rehabilitation medicine at the Samuel Oschin Comprehensive Cancer Center at Cedars-Sinai Medical Center. He has published on various topics in cancer rehabilitation and works with the Cancer Rehab Physician Consortium of the American Academy of Physical Medicine and Rehabilitation. Welcome, Dr. Chang, and thank you so much for joining us today.
Yeah, no, it's great to be here, and big thank you to Rebecca and CSC South Bay again for inviting me to speak again on another important rehabilitation topic. Today we're going to be talking about prehabilitation cancer, and thank you for everyone joining this afternoon. So to get started, the objectives for this session are going to include defining what prehabilitation is. Then we want to review some of the benefits of and evidence for prehabilitation. And then finally, we want to discuss some more practical points about how you can kind of reap the benefits of prehabilitation and kind of get started on your own program. This is basically a slide showing the number of different research articles that have been published over the past 23 years on the topic of prehabilitation. So we can see that there's basically been exponential growth, and that this is a really, really hot topic that a lot of people have a lot of interest in because of a lot of the benefits that it can give for patients. And I think a lot of this interest really comes from this concept of exercise and movement being medicine. So if you've heard any of my lectures before, you may have heard some of these topics as well, but it really stems from the idea that exercise is really just good for our bodies overall and in total. And it's so good that, I literally just came back from doing the stairs right now because we know that there's so many beneficial things that can happen when you incorporate it in your life on a regular basis. So, number one, exercise is medicine for your heart. So when you exercise, it decreases your heart rate. If you have high blood pressure, it can decrease your blood pressure. It can increase the amount of blood that your heart beats out with every beat to the rest of your body, which is basically the stroke volume. And it can reduce the amount of oxygen that your heart itself needs when it's at rest. We know that exercise is medicine for your lungs, and your vital capacity, which is the maximum amount of air that you're able to breathe into your lungs, is increased when you engage in a regular exercise program. And we know that exercise is medicine for your muscles, and it's no secret that when you engage in resistance training, your muscles will get bigger. But not only does it enhance your muscle growth and muscle size, but it increases the amount of energy storage, which is glycogen, that your muscles are able to hold. And it basically enhances and optimizes the efficiency of the way in which your muscles are able to utilize energy. And more increasingly, and perhaps more pertinent to our conversation today, we are finding increasing evidence that exercise is medicine in cancer. And that, it's not just that exercise helps all these different parts of your body that I discussed, all these different organ systems, but literally exercise is a tool that can be used to directly fight off tumors in the body. And the evidence that we're increasingly seeing is that exercise can control cancer progression through direct effects on the tumor. It can regulate tumor growth. it can improve the treatment efficacy of some cancer treatments. And that, of course, we're aware that it can also alleviate a lot of the side effects and burdens related to cancer and its treatments. So to kind of delve deeper into this idea of exercise being medicine in cancer, I just want to talk about a couple studies. So this is one study that they did in mice with lung tumors. And basically they divided the mice into two groups. One group of mice had free access to a running wheel, so they could just run around as much as they wanted to. And the other group of mice didn't have access to a running wheel, so they were much more sedentary. And that was basically the only real difference between these two mice. And you can see in the pictures, these black areas are the actual lung tumors. And we can see that in the mice that had free access to the running wheel, their lung tumors were much, much smaller in size compared to the more sedentary mice. This is another study that they did in actually healthy young individuals. And these individuals did not have cancer themselves, but they basically had these individuals do high intensity interval training, which is a kind of vigorous biking exercise. And they had them do this program. And then after they finished exercising, they took their blood and then they spun down the blood so they could just get the serum of the blood. And afterwards, they took this exercise serum and they exposed it to human lung cancer cells. And what they found was that there was something in the serum of these people who had just exercised that decreased the proliferation and survival of these human lung cancer cells. So, again, this is just going to show that there's something about exercise that really most likely activates our immune system to be able to directly fight off cancer. And then, of course, we know that aside from the direct effects against cancer, that exercise can help with a number of different side effects that often people going through cancer treatment can experience, including fatigue, anxiety, depression, lymphedema, decreased bone strength, as well as diminished sleep. And exercise can also help with all of these things. And for many of these things, there's actually quite a bit of evidence and research backing up those claims. So where does prehabilitation fit in? So everyone is probably familiar with the term rehabilitation, which is where you go through some kind of traumatic event or maybe some sort of illness like a stroke or a traumatic brain injury, and then you do rehabilitation where maybe you work with a physical therapist, an occupational therapist, or a bunch of different doctors, and after that drastic medical event, they kind of rehabilitate you to try to get you back to the place where you were before. Rehabilitation is exactly what it sounds like, where you kind of do all that stuff, but you do it before anything happens. So it's really the process of optimizing your functional performance prior to starting really undergoing some kind of usually medical intervention, most often surgery, so that you're kind of in the best shape beforehand, so we can kind of limit all the complications and side effects that may occur afterwards. So we can see here a definition of rehabilitation from Julie Silver, and they define it as a process on the cancer continuum of care that occurs between the time of diagnosis and the beginning of acute treatments, including physical and psychological assessments, establishing a baseline functional level, identifying impairments, and providing interventions that promote physical and psychological health to reduce the incidence and/or severity of future impairments. So it should be noted that most often rehabilitation will occur between cancer diagnosis and the start of cancer treatment. And most often it's before people are undergoing surgery as part of their cancer treatment. But while that is the most common definition, it is noted that rehabilitation can also occur in patients who aren't undergoing surgery, but maybe they will start rehabilitation before they start on radiation therapy, or rehabilitation before they start on chemotherapy, or for anybody who might be undergoing like a cellular transplant like CAR-T or an allogenic stem cell transplant, rehabilitation before undergoing those transplants. So it can really be before, there's some drastic medical intervention that we might expect could cause some side effects, but it doesn't have to be. It is also noted that prehabilitation can occur concurrently with treatment. And again, most often that'll be treatment of like chemotherapy or immunotherapy prior to somebody undergoing surgery. It should also be noted that prehabilitation is kind of a general umbrella term, and it's not only used in the context of cancer, but can really be used in the context of any kind of surgery. So you can prehabilitate before undergoing like a hip replacement surgery, or you could prehabilitate before undergoing like a transplant surgery, like a lung transplant or like a kidney transplant. So it is something that can occur in a variety of different situations. So why do we need prehabilitation, and why do we need it particularly in cancer? So it's because some of the surgeries that can occur can again cause, in some circumstances, some complications, and there's always risk of complication with major surgeries. Some of those risks are associated with being older or having a poor functional baseline. And we know that cancer does tend to affect older age groups. So it's really to try to decrease the risks involved with these kinds of surgeries and with the different treatments that occur. And we know that when complications do happen after people undergo these kinds of treatments, it can lead to longer hospital stays, and longer hospital stays can often be associated with more complications. So it's really to reduce the burden of complications that can occur, improve patient outcomes, and of course, all this can also reduce costs. So potential goals of prehabilitation, again, are to improve physical function, potentially decrease length of stay, decrease complications associated with treatments. And we don't really know if there's benefits with survival outcomes yet, but a lot of people are looking into this, and I think there'll probably be more research about this particular outcome probably in the next 10 to 20 years. So, what is prehabilitation? How do we get it? What does it consist of? Most prehabilitation is considered to be multimodal, and there's numerous different things that you are trying to optimize, but in general, there are 5 kind of primary components that can be integrated in prehabilitation. So the most common one that people talk about and really associate with rehabilitation is exercise. So exercise can either be general, which means that it's kind of just the general aerobic exercise or the general strengthening exercises that we would all do on a regular basis, or it can be specific targeted exercises. So these might be exercises that you might perform to optimize a specific area of the body that we might expect to be at greater risk for undergoing some kind of impairment after some kind of treatment. So an example might be if you are getting a type of chemotherapy that causes neuropathy that might affect your balance, then we might give you some balance exercises. Or if you are undergoing surgery for like a head and neck cancer, then we might give you some exercises to promote shoulder mobility or to promote mobility of the neck. So yeah, the exercise is most often the focus of rehabilitation programs. But then there are other components that are also of extreme importance, including smoking cessation, nutritional education, as well as stress reduction techniques. So with that said, we all know what prehabilitation is. What now is the evidence for prehabilitation and why we should consider doing it for ourselves? So we're going to kind of be breaking this down into different kinds of cancer, and we'll start with breast cancer. Post-operative disability involving the shoulder, typically the same side of the shoulder that anybody may be undergoing surgery on. Shoulder disability is really, really common, and this may include things like higher risk of frozen shoulder or increased risk for shoulder impingement syndrome, or just shoulder kind of muscle pain. So we know that there are kind of higher rates of this, and there have been some smaller studies that show that patients who do kind of those specific targeted exercise around this area that can be taught to people beforehand are not only possible, but it may lead to decreased rates of shoulder problems. So this is one study that showed that patients that didn't do as much surgery had longer recovery times. Basically, in the studies that have been done so far, it's been shown that prehabilitation programs in conjunction with typical standard rehabilitation programs helps to enhance the recovery of these shoulder problems that can happen. And the evidence, at least that exists so far, is at least good enough that the American Society of Breast Surgeons does recommend that in breast cancer patients, multimodal prehabilitation can be considered. So moving on to lung cancer, there have been multiple studies that have shown that patients with lung cancer who undergo rehabilitation programs can have improved feelings of shortness of breath. They have improved 6-minute walk test, which is basically a test that shows how good their endurance is, like their walking endurance, and that after undergoing surgery, they don't require as many days of a chest tube being in. And it appears to be better when you do the exercise before surgery, when they compared it to traditional rehabilitation, which would occur after surgery. This is a review where they basically looked at 13 different studies of 800 patients, and they found moderate quality evidence that, again, rehabilitation reduces postoperative complications, and it can also reduce the length of hospital stay in those patients who may be undergoing lung resection of their tumors. Moving on to colorectal cancer. This is actually where a lot of prehabilitation got started. And most of the research and most of the studies have been done in the colorectal cancer population. But in this study, they were looking at prehabilitation versus traditional rehabilitation. And they were basically had patients on home-based programs. So, and they were unsupervised, so just people kind of doing exercises by themselves at home, consisting of mostly aerobic activity 3 times a week. And they found that these patients basically had faster recovery times compared to the ones that underwent traditional rehabilitation. They also found improved walking capacity, improved endurance, but there was no difference in this particular study between complication rates and length of stay. This is another study that they did looking at prehabilitation in colorectal patients or patients with more benign lesions. And again, this was not a supervised program, and they did both biking and resistance training. They actually didn't find any difference in walking capacity, but they did find improvements in the endurance of these patients. Again, another study, and they basically found that patients undergoing rehabilitation had improved walking endurance. In this study where they did liver resections for colorectal cancer patients that had liver metastasis, they found that they had overall improved quality of life, as well as mental well-being, as well as improved usage of oxygen. In pancreatic cancer patients, they found that rehabilitation can be helpful in reducing delayed gastric emptying, which can sometimes lead to sensations of bloating and abdominal discomfort. And this is actually a really interesting study that was done, I believe, at MD Anderson. But in their prehabilitation study, they actually and this was actually in rats, I believe, but they basically had rats do like a rehabilitation program that had pancreatic cancer. And then they took out the tumors, and what they found was that the vasculature, the blood vessels going through the tumors actually changed in the animals that had undergone the rehabilitation program. What they think is that pancreatic tumors are generally, they don't have very good blood supplies. And they think that one of the reasons why it's hard to treat is because the chemotherapy can't get to the tumor that well. But if through exercise, you can increase the blood flow to and around the tumor, that could potentially improve delivery of the chemotherapy to the tumor, thereby making the treatment more effective. So that was a really interesting study that was done there. In this surgery, in this study, they found that patients had improved respiratory endurance, and this other study again improved endurance, shorter length of stay in the hospital, and basically improved or maintained albumin levels, which is kind of a marker of liver function. So this is a review where they looked at a bunch of different studies, and they found that patients who underwent prehab had significant reductions in overall and lung problems. And then this is another review that looked at over 50 studies, and they basically found that exercise at all levels, but including before, was beneficial for patients of all cancer types. That moderate to vigorous exercise is the best. That if it's supervised, it's better than if it's unsupervised. But again, discussing some of those studies that we've just reviewed, even the unsupervised programs, people just doing stuff by themselves at home, those patients reap benefits as well. It seems to be safe, as serious adverse effects are not really common. But in this particular review, they weren't looking at advanced cancers. With that said, prehabilitation we see can have a lot of benefits, and there's quite a bit of evidence supporting its use, but there are definitely some challenges with implementing it. And these challenges include that everyone's functional ability is different. Everyone has a different baseline, and everyone's undergoing different treatments, and everyone has a different kind of cancer. So because of this, there's not really any standardized prehabilitation protocol that can be given for a single person, and everything does need to really be customized to a degree, as people have different deficits based off the kind of cancer they have, the kind of other medical problems they have, as well as the stage of their cancer and the treatments that they've been through so far. There's very, very little in the way of standardized protocol. And all these studies that I've referenced, I mean, they're just that, they're studies. So there are honestly not that many rehabilitation programs out there. Finding a study for yourself in particular may be a difficult thing to do. But that doesn't mean that we can't do it, and that we can't utilize the principles that we've discussed to kind of start on our own rehabilitation program. So with that said, I just want to talk about a few further considerations before we go into, how can we start rehabilitation? And those considerations include safety, timing, cancer type, and FITT prescriptions. And we'll go into shortly what exactly that means. So the first thing is safety. So a lot of the exercise guidelines that are out there for prehabilitation are based off of this study that was done. Well, not a study, it was actually a roundtable review where they looked at all the evidence for the existing studies they haven't done, but these are basically guidelines from the American College of Sports Medicine, where they basically all got together in 2018 to, again, look at all the research that's been done and making guidelines for how patients with cancer should be exercising. And when they were reviewing all the literature, they basically stated that they don't want to create any barriers to people starting on physical activity. So for that reason, they state that no assessments are required to start on a low intensity aerobic training program, such as walking or cycling, and that resistance training with gradual progression or flexibility program is okay to do, again, without any kind of medical assessment in most survivors. That said, they do recognize that, again, everyone's different, and that some people have different medical kinds of problems. So they do refer to the National Comprehensive Cancer Network guidelines to talk about in which situations medical clearance or further medical evaluation may be needed before starting on an exercise program. So these are actually the risk assessment guidelines from the National Comprehensive Cancer Network. And we can see if you have any of the morbidities kind of in this box, so peripheral neuropathy, arthritis, musculoskeletal problems, poor bone health, or lymphedema, they do recommend that a pre-exercise medical evaluation occurs, and that depending on the results of that evaluation, that specific recommendations for an exercise program be modified based on these assessments, and referral to trained personnel can be considered. And for anybody that has comorbidities aligning with the issues in this box, including history of lung surgery, history of major abdominal surgery, an ostomy, heart failure, heart disease, lung disease. This is chronic obstructive pulmonary disease, ataxia, severe fatigue, severe nutritional deficiencies, or worsening changing physical condition, which could be applied to a lot of different things. That anybody with these kinds of issues should have a pre-exercise medical evaluation, and also should have clearance by a physician before exercise. They should also be referred to trained personnel. So this doesn't necessarily have to be a doctor like me, but could be your family doctor, your primary doctor, your oncologist. But these are the recommendations from the National Comprehensive Cancer Network in regards to safety before engaging in an exercise program. So the next thing that I want to talk about is timing. So, prehabilitation is something that is supposed to occur before you start on treatment for cancer, whether that be chemotherapy, immunotherapy, surgery, or radiation, or whatever the treatment plan is. But that doesn't mean that we should delay treatment in order to start rehabilitation. That can be considered maybe in certain circumstances, but for the most part, we never really want to delay treatment, and getting treatment for cancer in a timely fashion is always of utmost importance. So we want to consider how much time actually exists between the time of diagnosis and when treatment is going to be started, because most of the studies that we talk about basically lasted anywhere from 6 to 12 weeks. And this is generally considered the amount of time that's needed in order for therapeutic exercise to really reap a significant benefit. So if the lead time to starting treatment is really, really short, like 1 week or maybe 2 weeks, then a prehabilitation program may not be feasible in that setting. That said, for people whose treatment plans include undergoing neoadjuvant treatment. So neoadjuvant treatment is basically getting chemotherapy or radiation therapy or immunotherapy prior to surgery in order to kind of shrink down the size of the tumor. Then you could do prehabilitation while you're doing those treatments. And you'd be considering the prehabilitation aspect to be you kind of optimizing your functional status before you undergo the surgery that is upcoming. So it all kind of depends on the specific situation. Next, I want to discuss cancer types. So again, there are so many different kinds of cancer, and the different kinds of cancer have different treatments that are applied to them. And those different treatments will cause different impairments. So for example, somebody with like a lymphoma or leukemia, they might be getting a specific kind of therapy known as a beta alkaloid, which can cause a very specific kind of neuropathy, which again could affect your balance. You might want to focus on balance exercises for that person. Or somebody with breast cancer, and they have like disease in the lymph nodes, and maybe they're going to get a bunch of lymph nodes taken out. And we want to or we may have some concern of lymphedema, and we may want to have them engage in more resistance training in their arms that kind of get their muscles pumping to try to limit the risk of lymphedema. So it really depends on the kind of cancer that exists, as well as the treatments that are going to be occurring that will dictate the kinds of specific exercises that you may or may not want to include in your prehabilitation program. And finally, we want to think about how our exercise prescription will actually look like. And we want it to kind of follow the structure of FITT. And what FITT stands for is frequency, intensity, time, and type of exercise. So we just want to be really, really specific with what our exercise instructions are. And the frequency is basically how often we're doing it. The intensity is how hard are we doing it. So light, moderate, or vigorous, with moderate or vigorous typically being better. How many minutes of exercise are we going to be doing, which is the time, and then what types of exercise are we going to be doing. So an example of a FIT prescription would be 30 minutes of moderate intensity cycling 5 days per week. So we want to be very, very specific about what we're going to be doing. So finally, I do want to discuss how we can all start on rehabilitation programs ourselves. And again, it's going to be difficult for you to find something in the community or even a study that you could get be a part of. So it's not necessarily a realistic thing to do or look for, but again, a lot of the studies that were done, it's just people doing exercise programs by themselves. So if you can, if you are in one of those groups of people that do need to get medical clearance, and once you do get medical clearance from your primary care doctor or internist or oncologist, then you could just start on a prehabilitation program potentially by yourself. So how can we do this? So we go back to our common components of rehabilitation, and we just kind of incorporate all these things that we can, right? So one of the major components is smoking cessation. So hopefully, no one here is smoking. But if you are, then now, would be a great time to quit. And if you need help doing those things, there's so many different kinds of medications and pharmacologic interventions that can help these days. And honestly, I would just recommend that you talk to your primary care provider about what those things might be. But yeah, it's really, really important that smoking stops, because literally smoking, it constricts like all of your blood vessels. We want more blood flow to the different parts of our bodies, and smoking basically stops that from happening. So this is something really bad and something that needs to be stopped. The next thing that we want to look at is reducing stress. So there are many, many different ways that this can be done. And thankfully, this is something that can be found in the community. So, for example, some of the programs that we have at Cedars-Sinai include Qigong, the GRACE program, which is growing resilience and courage, coping through mindfulness, gentle yoga for wellness, and art therapy. And if you're interested in these programs, you and your oncologist is at Torrance Memorial, they may be able to refer you to some of these programs. So if not, there's a lot of other programs out there. So this is from WeSpark, and literally you can just go on their website, WeSpark, and they have so many different kinds of programs that can basically help with stress reduction and teach about different stress reduction techniques. And then there's Magnolia House, and again, you can just go to their website and they have a calendar. This is a calendar of last week's events, but if you go, they'll have a calendar of this week's events and next week's events, and there's just so many resources. And then unfortunately, I don't have the ones available at Torrance, but they do. I recently found out that they have a social work, and they actually also have a bunch of these kinds of things. I think they have like a yoga thing that they teach. I think they also have like a guided imagery or meditation thing. But I'm not sure if CSC South Bay has stuff, but they probably do. But the point is that yeah, a lot of these different kinds of stress reduction programs are out there. And if you have questions about it, I would recommend that you talk to that you ask your oncologist for a social worker referral. And a lot of times the clinical social workers will know about kind of the programs in your specific geographic location, and they'll be able to refer you to these types of programs for stress reduction techniques. Okay, so moving on to the next component is nutritional support. So unfortunately, I'm not, a registered dietitian or clinical nutritionist. So it's beyond the scope of this particular talk to talk about what those specific recommendations could be. In general, it's a lot of stuff like stay hydrated, keep like red meat like less than 17 ounces per week, I think. Like have a plant-forward diet. Make sure that you get like a lot of healthy fibers, reducing added sugar intake. So it's a lot of things like that. But thankfully, there's a ton of information out there regarding how you should be eating, how we should be eating, and a lot of guidelines that already exist. So I encourage you to check out these specific resources. So this is the American Cancer Society. They talk about nutrition both during and after treatment, give guidelines, and then cancer.net. Cancer.net is actually a really, really great website. And they're actually endorsed by the American Society of Clinical Oncology, or ASCO, which is like the major oncology organization in the United States. So most of their information is really, really good. So and they have really, really great nutrition recommendations. So I would recommend that you check that as well. Check out that as well. But if you do have more kind of specific questions, depending on where you are, your oncology team may be able to refer you to a registered dietitian who would be able to, kind of answer your more specific questions and give you more specific customized guidance as to what kind of your best nutritional plan would be. Next, we have specific targeted exercises. So again, this is very much going to depend on the kind of cancer that someone might be going through, as well as the different specific kinds of treatments that they have been receiving for it. But for example, in breast cancer, we have kind of our own specific exercises that really focus on maintaining shoulder mobility to prevent a lot of those shoulder problems that may occur. But again, this will be different depending on if you have like leukemia or lymphoma, in which case, maybe you're preparing for an allogeneic stem cell transplant, and we're really worried about the deconditioning that could occur with a longer hospital stay. So we might be, working more on proximal muscle strength, like around your hips and your shoulders, as well as your endurance for stamina. So again, these focused types of exercises will really depend on the kinds of problems that we are anticipating. And then lastly is the general conditioning exercise. And this is something that, everyone can do once we're sure that it can be done in a safe setting and that you have clearance from your medical team if needed. So the general conditioning exercise program, again, is mostly going to be based off of the recommendations from the American College of Sports Medicine guidelines from 2019. And what we're going for is 150 minutes per week of moderate intensity aerobic exercise, in addition to 2 to 3 days per week of strength training targeting major muscle groups. So this is very much in line with guidelines from the National Comprehensive Cancer Network, where they basically also say 150 minutes moderate intensity, or they do also state that if you're able to do vigorous intensity, that you could do 75 minutes of that instead of 150 per week. Their guidance regarding resistance training is basically the same. Now, for somebody who is not used to exercising regularly at that level, there is guidance regarding an initial prescription for those who are just starting out. And the suggested frequency is maybe you could start at 1 to 3 days per week. And instead of doing moderate to vigorous intensity, you could do light to moderate intensity. And that really the initial time goal for how much you're exercising in minutes in a single day or at a single interval should really be customized to kind of your baseline level of fitness and how much exercise you're able to currently tolerate. Okay, so this entire time I've been talking about light, moderate, and vigorous intensity. What exactly does that mean? So there are very specific definitions of what counts as moderate intensity or what counts as vigorous intensity. And this is basically based off of how fast our heart is beating or how much oxygen our body is consuming during exercise. So that's actually how we define these different exercise intensities. So a lot of this is based off of how old you are, which is then that your age is basically used to estimate what your maximum heart rate is. And then we kind of go for a target heart rate zone. So this is kind of how we used to calculate, what your aerobic heart rate zone should be while undergoing aerobic exercise. The problem with that is that everyone's baseline heart rates are super different because somebody who is a marathon runner will have a much lower heart rate than somebody who doesn't exercise nearly as much. So for that reason, we look at this other thing called heart rate reserve instead of just your heart rate. And your heart rate reserve is basically how much extra your heart can beat in a minute beyond your heart rate at rest. So we calculate this by calculating what your maximum heart rate is. Again, that's just estimated to be 220 minus your age. And then, so let's say for a 40-year-old individual, your maximum heart rate is 180. And then you subtract whatever your heart rate at rest is, which is, your heart rate when you're sitting down. So, maybe somebody who's 70 years old, you have 180 minus 70, that would be 110. So that'd be heart rate reserve, meaning that your heart can beat, 110 more times per minute. And then basically, we calculate a bunch of other numbers here to figure out what the lower level is for moderate intensity and what the higher level is for upper intensity. And again, for just our example of a 40-year-old person with a heart rate of rest of 70 and a heart rate reserve 110, we calculate that for moderate intensity, their heart rate should be between 114 and 135. Okay, so this is like a ton of math to do, and I don't expect anybody to do all these calculations before engaging in an exercise program. So there's a much easier way. What we can actually do is we can use our work of breathing as a proxy for how fast our heart is beating. So when you're engaging in light exercise, you should not notice any noticeable change in your breathing pattern. But when you're engaging in moderate exercise, you should be able to talk. So you should be able to carry on the conversation still, but you should not be able to sing. That's how hard you should be breathing. And when you're engaging in vigorous exercise, you should be able to say a few words without stopping to catch a breath, but really you shouldn't be able to do more than that. So if you're following this kind of pattern while you're exercising, it's very likely that your heart rate is in that zone where we want it to be, to the point where you will be getting these benefits that we discussed. So, I'm just going to point this out. This is from the National Comprehensive Cancer Network also, and they list yoga as being light, moderate, or vigorous. And it's because it just depends on what kind of yoga you're doing and how hard you're doing it, which will determine, how fast basically, your heart is beating. Just a quick note on high intensity interval training. The American College of Sports Medicine does note that there's not enough evidence right now to make recommendations for prescriptions around the safety and use for high intensity interval training, but research is ongoing, and that for people who are generally inactive, it shouldn't be advised, at least for now. Okay, so that's resistance training. In terms of guidelines for, that was aerobic training. In terms of guidelines for resistance training, we want to do exercise that are targeting all major muscle groups. We want to do them 2 to 3 days per week. In general, we're going for 8 to 15 repetitions per exercise, per set. And then we want to do 2 to 3 sets of each exercise. So if you've never done resistance training before, then I'm going to be just going over some easy exercises you could do at home. But for those who are used to exercising on a regular basis, you basically can keep doing what you're doing, but you just want to make sure that you target all major muscle groups. So, that's back, chest, arms, legs, yeah, be getting in, I would say, like a good 6 to 8 exercises total per session. Okay, so this is an example of an easy exercise that you can do to strengthen your back. These are just rows, and you can do this either seated on a chair, or seated on the ground. And basically, you can get these resistance bands. You can get these for like $10 to $30 off Amazon, or if you go to any a lot of retail pharmacies will have them, or like a Target or any sports store, you can get these resistance bands and kind of start on these programs. But this is just a really easy exercise that you can do to start work out your back. And again, we're going for 8 to 15 repetitions, 2 to 3 sets, and 2 to 3 days per week. For our chest, we can take our resistance band, put it on the back of a chair, grab both ends, and you just push forward, and you have an instant chest press. For our thighs, we can basically tie the resistance band around our knee areas here, and then you just kind of do these clamshells. Again, 8 to 15 repetitions, 2 to 3 sets. For our legs, we can get our quads by tying the resistance band around our ankles. You hold one leg back and lift the other leg forward. And you could either tie it to each other, or you could tie it to like a chair or something stable. So it's just held in place for you. And then there's tons of ways we can exercise our arms, but basically, you just want to hold one end of it steady, either with your hand or by stepping on it. And then you can just kind of flex your arm upwards in a curling action to get your biceps. And yeah, that's basically it. So I'd be happy to take any questions now. And I guess I'll stop sharing here.
Thank you so much, Dr. Chang. There's a couple of comments in the chat that we get started with. Let me pull it up. Where is it? Okay, there you go. Okay. Oh, this is back when you're doing your data. How did they determine that 87% of cancer patients are over 50 years old, and why do they get cancer?
Yes, that's a very good question. Okay, so in that particular study, I don't recall how they determined the prevalence of the age group, but generally, a lot of times they're usually, for those kinds of studies, they're looking at like national data. So they're just looking at, everyone who's had a cancer diagnosis, and then they're just looking at, and then, they just put it like an Excel spreadsheet and then calculate like the average age, or they look at like the median age. So that's generally how they're doing that. Why do they get cancer? Yes, another tricky question. I'm probably not qualified to answer that. I would defer to an oncologist. But in general, the theories are that, a lot of times cancers occur because of mutations in our cells. And, there's all kinds of things, in life that can cause mutations to different kinds of cells. And, the longer we live, the more exposed we might be to some of these things. Or, yeah, I would say I would leave it at that. But I think if you talk to your oncology team, they would be able to probably give you a better answer.
Thank you. This is a little bit longer. If you don't mind reading it in the chat.
Oh,
we do
yeah,
have a participant who maybe has, can provide some like sample exercises. She has multiple myeloma for 17 months. She does have 5 compressed discs. She does wear a back brace. She is part of a walking group, so she does get walked in 73. So she's concerned about just exercise.
Yeah,
she wasn't
you
told
would
to
have
lift.
to be, yeah. So, when we're looking at those National Comprehensive Cancer Risk Assessment Guidelines, yeah, so if that's the case, I mean, you would have kind of the bone health issues, which, would basically mean that you would want to get medical clearance before engaging in a program. What I can tell you, and again, I can't say that this is specific customized advice because I don't know you and your history, and I've never seen you in person. So you definitely should talk to somebody in person who knows you, your history, and who's examined you. But generally, what I say is for anybody engaging in the resistance program, if you have pain with weight-bearing activities, so like if you have pain, like especially in your back, like with walking or standing, or like if you have myeloma, or yeah, if you have multiple myeloma and you know that you have like lesions like around like your arms, like your humeri, or like your hips, then we know that you're at increased risk for fracture. And if you have pain, like when you're carrying something, particularly something heavy, then I would generally be very, very cautious with starting any kind of resistance program, because you could be at increased risk for fracturing that bone. That's not to say that you can't do it at all, but you just have to be very, very careful. You should be doing it under the guidance and supervision of like a specialist, preferably like a physical therapist, who has experience in working with people with bone lesions in cancer. And it would have to be very, very slow, starting at a very, very low rate and very, very gradual. But in terms of, aerobic exercise, you can continue to engage in aerobic activity, particularly, if you're not having, a lot of increased pain while doing that. If you do have pain while doing things like, walking or biking, then, one thing that I'll always consider is pool therapy or aquatic therapy. It's not the easiest thing to find, but that can be really, really useful in basically alleviating a lot of the body weight. So people are able to engage in aerobic activity with, putting less pressure on their joints.
Thank you. If anyone has any questions for Dr. Chang, you can either unmute yourself or you can type it into the chat and I can read it for you.
Oh, or
Well,
I just see one more
yeah.
question, or I think I see just a follow-up kind of to that. Okay, so concerned with compression disc and exercise, told not to lift a gallon of milk 5 pounds.
That's the same participant.
Exactly.
Yeah.
So there's basically specific motions. Oh, not a lot of water yet. Okay, yeah, so that's tricky. So there's basically certain positions and certain kinds of exercises that do put a lot more pressure on your lower back, in particular, that can put you at increased risk for developing like a compression fracture, or a further slip disc. Those are more abdominal exercises like crunches or sit-ups. So you definitely want to avoid anything like that. Basically anything where you're like hunching forward like this in a chair, or anything where you're flat on your back and like lifting your legs a little bit, that puts a ton of pressure on your back. You definitely want to avoid anything like that. In terms of not lifting, more than a gallon of milk, I would say, if that's what your doctor's told you, then I would defer to them. But it really does depend on, where you have lesions, how big those lesions are, as well as if you're having pain. If you're looking to potentially increase the amount of weight you can lift, I would recommend that you possibly see an orthopedic surgeon, and they would be able to look at your imaging, or they might order new imaging of like, your shoulders and your hips. And they could tell you, more specifically if you could or couldn't lift potentially more weight and what your risk of fracture might be.
Wonderful, thank you. If anyone is typing into the chat, I'll give you a minute, but while you are, I did want to let you know that Dr. Chang is going to be back next month. It's in the chat, addressing long-term complications following cancer treatment. So it's going to be on Thursday, February 16th from 1 to 2 p.m. on Zoom. So you're able to register on our calendar website. So please do so if you're interested. I'm going to be, let's see,